Hello, my name's Dan. I'll be your nurse for today. I'm doing hand hygiene. So how are you doing today?
I'm doing all right.
Checking all the lines. That's good. Okay. At first, can you tell me your name and date of birth?
Caitlin Burns, 6888.
All right. You know where you are today?
Yes.
Can you tell me where that is?
South Shore Hospital.
Great. All right. I'm gonna go ahead and raise your bed up. Is that okay? Okay. I'd like to do a head to toe assessment on you. Before we get started and while I'm doing this, can you tell me if you were experiencing any pain today?
A little bit in my left knee.
Left knee. Okay. When did that happen?
About a week ago. It's on and off like a stabbing pain.
Like a stabbing pain about a week ago? Okay. And on a level of 1 to 10, can you tell me how bad the pain is?
About a 3.
About a 3. Okay, I'm going to bring this down real fast. Okay. All right, I'll go ahead and annotate that. I'm going to put gloves on. All right, so what I'm going to do first is I'm going to move down from head to toe.
Okay.
Okay. And before I do that, can you tell me if you have any allergies today?
No, I don't have any.
No allergies. And are you taking any medication for your knee?
Just some Tylenol every now and again.
Tylenol. Okay. And any other medication that you're taking for any other reasons?
No.
Okay. All right. I'm gonna go ahead and get started with your head. All right. Right now I'm checking for lice, for any problems with the scalp, any lesions, things of that nature. I don't see anything, so I'm gonna go ahead and move to your ears. Everything looks good there. Go ahead and move to your eyes. You can look at me, please. And I'm checking the pupils, which are nice. They constrict and they react equally to light. Okay. And if I can, should pull your eyes lids down. Okay. And I'm checking the conjunctiva, which looks nice and pink. The sclera looks white, so that's good. And if you can do me a favor, I'd like you to follow my pen without moving your head. Okay. Follow it in back out. Okay, and pupils are accommodating, so that's a good sign. And I'm just going to take a quick look in your nose. No abnormalities. You can open your mouth. Alright, mucous membranes are nice, moist and pink. Can you stick your tongue out for me? Nice and straight. And can you smile? Alright, and that's nice and even. Okay, moving down to your neck, I'd like to check your carotid artery. Okay, this is good. Seems equal on both sides. Give it a +2. All right, I'm gonna move down to your upper extremities. First, I'd like to just kind of squeeze here. Now, are you feeling any pain, or is there any tingling or numbness in your arms? Okay. Let me check your pulse. Those are nice and even, also +2. And I'd like to check your strength. So if you could just push up on my hands. Okay, now push down on them. All right, squeeze my fingers. That's good. Okay, see this hand real fast. Check your capillary refill. All right, they seem to be repopulating within 3 seconds. So that is also good. And you have an IV in, I see. So this looks good. IV doesn't show any signs of infection or irritation, so that's good. All right, now I'm going to go to the chest cavity. I'd like to do your heart first. So there's a couple points that I'd like to listen to. Is that okay?
Yep.
All right. The first one is going to be the aortic valve. Move over to pulmonic. Now I'm going to move down to Erb's point. Down to the tricuspid. And over the fifth intercostal midclavicular line. On the left side is going to be the mitral valve. It's also the apical pulse. Okay, heart sounds good, and we would listen to your respiration.
Okay.
Take a deep breath for me. Another one. Another one, please. Again. All right. Another deep breath. Thank you. All right. And I'll go ahead and raise you up.
No, like, I'm thinking about the neck.
Go ahead and try to sit forward for me. All right, take another deep breath. Again. 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 And one more time. And now while I'm doing this, I'm staying in between the vertebrae and the scapula. Okay, you can go ahead and lay back. Now, since I didn't ask you, are you feeling any discomfort while you breathe? When you take those deep breaths, any chest pain?
No.
Nothing? Okay, great. All right, I'm going to go ahead and move down to an abdominal assessment. Excuse me. Pull this down. So first thing I'm going to do is I'm going to inspect the abdomen. I'd like to do it from 2 angles. Look for any distension, any irregularities. I don't see anything. All looks good. So from the inspection, I'm going to go ahead and auscultate. You mind if I listen to your abdomen?
It's fine.
Okay. So I'm going to start down on the right lower quadrant, right upper quadrant, left upper quadrant, down to the left lower quadrant. Okay. Now I heard activity on all of those. If I did not hear activity, I would have stayed for up to 5 minutes until I heard something. Okay. And I'm going to go ahead and palpate lightly. If you can tell me if you're experiencing any pain while I do this. Also, as I'm doing this, can you tell me if you the last time you defecated?
This morning.
This morning, okay. Any diarrhea or vomiting? Okay. And how about urinating? Do you have any problems urinating?
No.
No? Everything's normal?
Yep.
Okay, good. All right. We'll cover you back up here. Now I'd like to move down to your legs. Tangle here. Okay. So I'm just going to kind of feel around a little bit. Now, let me know, are you feeling any numbness or tingling? And how's that pain feel at me?
It's not there right now, but
Okay. And then can you go ahead and, so I can check your range of motion, can you plant your right foot and bring your right knee up? Down. Here. And as I'm doing this, I'm checking your skin integrity. All looks good. You go ahead and put this back down. Can you do the same thing with your left foot? Okay, can you bring that back down? All right. And as I'm checking it, I'm looking for any edema, especially around the ankles. I don't see anything. As I come down to the feet, I'd like to check your pulse. Okay. Both are nice and even, +2. And your strength, can you go ahead and push into my hands? Other way. I'd like to see your cap refill. Once again, those are repopulating within 3 seconds. So that's good. All right, cover you back up. All right, so that's it for today. Do you have any concerns that you'd like to tell me before I leave?
not right now.
All right, I'm going to give you the call button. Here you go. Keep that right next to you. Just let me know if you need anything.
Okay.
All right, and I'm going to go ahead and lower your bed back down for you. All right, bed's all the way down. And I'm going to wash my hands. All right, well, just let me know if you need anything, okay?
Thank you.
Thank you. That's it.